You're good to go.
Yes. Oh, you mean it's already recording?
Yes,
Oh, okay. I'm sorry. Okay.
that's okay.
I'm Diane Newman, and I would like to present this poster on development of clinical practice principles for intermittent catheterization. This is a poster that was accepted by SUNA and will be shown at their annual meeting in the end of September in Orlando, Florida. This was a quality improvement project, and it was an international project. As you can see, I had many other nurses who were experts in the area of intermittent catheterization from around the world. Basically, the background of why we decided to do this quality improvement program is that every person deserves access to high quality care in all healthcare settings delivered by trained healthcare professionals that promote quality of life, foster shared decision-making, and informed consent. But really, the clinical reality of intermittent catheterization is that many patients receive inadequate education when we first teach them how to perform catheterization. Many patients are not informed, motivated, and engaged with their own care, and they risk lapsing in their routine or really don't adhere or follow our instructions as far as how to perform intermittent catheterization. And of course, this can lead to complications that we really do not want to see in this population. There are gaps in current clinical practice that highlights a need for guidance principles to ensure appropriate engagement between the clinician and the person performing intermittent catheterization. And this quality improvement project really applies to both men and women performing intermittent catheterization.
Diane,
yes.
are you seeing that gray square on your?
Where?
There's like a gray rectangle over your slides. And now there's one at the top too. I don't know what's causing that.
And that's
Like
weird.
it's covering up part of the.
Is it still there?
Yeah, now it's on the bottom.
Well, that's me and you and the Read AI meeting. I wonder how you get rid of that.
I've never noticed that before. It's never been on any of the other.
Well, let's go back in and let me see what I can do with that. Do you mind?
No, that's fine, because it was covering up on your first slide, it was covering up the top of the picture.
Yeah, I know. And I moved it down to the bottom, but I don't know why it's there. Is it still there? Is it still there all along?
Yeah, it's still there.
All right, let me go back out and come back in, okay? I'm sorry, Angela.
Okay.
All right.
Go ahead.
My name is Diane Newman, and I'm presenting a quality improvement project, development of clinical practice principles for intermittent catheterization. This is, oh God, now you hear the phone, don't you?
No, I didn't hear it.
Oh, I'm sorry. Can you stop that and start back up?
Yep, go ahead.
Right, you sure you don't hear that?
Now I do.
Okay. How about now? Is it quiet?
It's quiet.
All right, let's start again. Hi, I'm Diane Newman. I'm presenting a quality improvement project, development of clinical practice principles for intermittent catheterization. This is a poster that will be presented at the SUNA annual meeting in Orlando in late September. This was an international project, and you can see my fellow experts in the area of intermittent catheterization who were involved in this project. A little bit of background. Intermittent catheterization is an ongoing procedure that we perform in urology, but every person deserves access to high quality care in all healthcare settings. And we really want trained professionals to provide that care to promote quality of life, foster shared decision-making, informed consent. However, the clinical reality of intermittent catheterization is that many patients receive inadequate education when we first teach them how to cath themselves. So if patients are not informed, motivated, or engaged in their own care, adherence to what we want them to do for intermittent catheterization as to frequency, how to perform it, may not be followed. And there really are gaps in current clinical knowledge as far as the practice of intermittent catheterization. So we felt that we needed to develop guidance principles for clinicians and actually for patients. So the objective of this project was to develop clinical practice principles for IC or intermittent catheterization to standardize care and improve outcomes. We want to provide brand agnostic best practice guidance for users and healthcare professionals for the entire duration of intermittent catheterization, regardless of age, sex, or race. And I really want to commend Convatec as they supported this project. But again, they were hands-off in this whole project. These clinical practice principles are the result of us clinicians. This is actually a poster that you will see at the SUNA meeting. I'm only going to provide some highlights here on this audio so that you kind of understand it. There were three main categories of principles that we have developed: pre-treatment, initial catheter selection education, and lifespan of intermittent catheterization use. What we did is we developed these principles, and then we actually held a focus group of 7 individuals who were performing intermittent catheterization. So they were actually users of intermittent catheterization. It was a qualitative survey, and we asked some specific questions as far as, oh, you know what, this slide is messed up. I'm sorry, Angela, we're going to have to start over. I'm so sorry, because this is all messed up. Here, I thought we'd be pretty quick on this and taking forever. What I probably should do is this. Hello, I'm Diane Newman. I'm a nurse practitioner, and I'm going to present a qualitative project on development of clinical practice principles for intermittent catheterization. This is a presentation that will be a poster at the SUNA uroLogic annual meeting in Orlando, Florida at the end of September. This project was supported by Convatec. However, it was developed by an international, let's start back over. I'm sorry. Let me start back over, Angela.
Go ahead.
All right. Hello, I'm Diane Newman. I'm a clinician and nurse practitioner in urology. I'm going to present a quality improvement project on development of clinical practice principles for intermittent catheterization. This was an international project. My fellow clinicians are experts in the area of intermittent catheterization in several populations, including men, women, and actually those with multiple sclerosis, so with neurogenic bladder. This poster will be presented at the SUNA annual meeting in Orlando, Florida at the end of September. I want to thank Convatec, who provided support for this quality improvement project. However, they were not involved in the decision-making as far as the specific principles. To give you a little bit of background on intermittent catheterization, we feel that every person deserves access to high-quality care in all healthcare settings, delivered by trained clinicians that promote quality of life, foster shared decision-making, and informed consent. However, the clinical reality in this area is that many patients receive inadequate education at the initiation of IC. If patients are not informed, motivated, engaged with their own care, they may not adhere to that schedule, those instructions that you give on intermittent catheterization, and it may lead to complications with catheterization. So there are gaps in the current clinical practice, and we felt that there was a need to have some guiding principles to ensure adequate and appropriate engagement in individuals performing intermittent catheterization. Now, we had some objectives with this quality assurance project. We wanted to develop clinical practice principles for IC to standardize care and improve outcomes. We wanted to provide brand agnostic best practice guidance, so no matter what catheter they use, these guidance principles can be used. And we wanted these for actually users, patients, and healthcare professionals, regardless of age, sex, and race. This is actually the poster that you will see at the SUNA meeting, and I would just want to highlight a few things for this presentation to give you a little bit more background. There are 3 areas, 3 sections in this clinical practice principles. Pre-treatment, what do you do prior to initiation? IC on that individual patient, initial catheter selection and education, and then the lifespan of IC use. To see whether these were really are important for IC users, we did a small qualitative survey using the Delphi method, and we asked 7 IC users to review our guidance and to give us some feedback. And basically, we had 100% agreement. You can see how these individuals stated that these principles helped prepare them. They guided their expectations when they started initiating IC. They helped them self-advocate for themselves. They also opened a dialogue that they could have between themselves and the healthcare professional. And they also felt that that really encouraged collaboration. So it was really a very positive outcome of their review of our principles. So we felt really good about that. This really is applicable and realistic in IC teaching. So basically, we hope that these practice principles will be significant and help you as a first step towards improving compliance with catheterization, but also guide you as far as what you want to include when you start a patient on intermittent cath. It's really life-changing for patients of all ages, men and women. We are going out to get kind of support for these principles, and basically they've been endorsed by SUNA, IOGA, the International Urogynecological Association, WOCN, and the United Ostomy Association of America. Thank you very much for listening, and I hope you attend the meeting or attend the meeting virtually and review the poster in more detail. But thank you for listening.